Hi, and welcome. If you're expecting a baby soon, congratulations. Today, we're covering everything you should know before going into labor. We'll go over recognizing labor signs, knowing when to go to the hospital, packing essentials, pain management, and more. Let's dive in and make sure you're ready for the big day. 1. Choosing the right hospital and planning your route. Before labor starts, you'll want to know exactly where you're going when it's time to deliver. Here's what to consider. Choosing a hospital. If you haven't already chosen, make sure to select a hospital or birthing center that is approved by your healthcare provider. It should meet your needs, whether you're looking for a natural birthing environment, a facility with an NICU, or specific pain management options. Taking a hospital tour. Many hospitals offer virtual or in-person tours. This can help you become familiar with the labor and delivery rooms, waiting areas, and amenities. Know the route. Plan the route to the hospital in advance. Use a map app to estimate the driving time under normal traffic conditions, and consider an alternate route in case of delays. Parking and entrance. Some hospitals have specific entrances for labor and delivery. Make sure you know where to go and any parking details, so you're not searching for an entrance when time is critical. Transportation plan. Arrange who will drive you to the hospital, and have a backup plan in case of an emergency. Having all these details sorted out in advance will give you peace of mind and help reduce stress when labor begins. 2. Recognizing the signs of labor. The first thing to know is how to recognize the signs of labor. Labor signs can vary, but there are some common indicators to watch for. These include contractions. You may feel regular, rhythmic contractions that gradually get closer together, last longer, and increase in intensity. Lower back pain. Persistent lower back pain can be an early sign, often feeling like a dull ache that doesn't go away. Pelvic pressure. A feeling of increased pressure in your pelvic area is common, as the baby moves down. Bloody show. You may notice a mucus discharge tinged with blood, which is a sign that labor may be near. Water breaking. When the amniotic sac ruptures, it can feel like a sudden gush or a slow leak of fluid. If this happens, contact your healthcare provider right away. It's essential to start timing your contractions. If they're regular and getting closer together, you may be in active labor, and it's time to prepare for the hospital. 3. When to go to the hospital or birth center. So, when should you actually head to the hospital? Here's a helpful guideline. 5-1-1 rule. Go to the hospital when contractions are 5 minutes apart, lasting 1 minute each, for at least 1 hour. If your water breaks, if you feel a gush or trickle of fluid, it could be your water breaking. Even if you're not having contractions, contact your healthcare provider and go to the hospital. Other concerns. If you experience intense pain, bleeding, or other unusual symptoms, it's best to go to the hospital or call your provider. Always follow your healthcare provider's guidance on when to come in, as each labor experience is unique. 4. Packing your hospital bag. It's a good idea to have your hospital bag packed by around 36 weeks. Here's what to include. Essentials for you. Bring comfortable clothes, toiletries, and any personal items that help you relax, like a favorite pillow or essential oils. Important documents. Don't forget your ID, insurance card, and any hospital paperwork or birth plan. For the baby, include diapers, a going-home outfit, a baby blanket, and a car seat for the ride home. Comfort items. Lip balm, a water bottle, and a phone charger can be very helpful during labor. Snacks and entertainment. Labor can sometimes take a while, so snacks and something to keep you entertained can be helpful, especially for your support person. Having these items ready in advance makes the process much smoother. 5. Pain management options. Labor pain can be intense, and it's helpful to know your options. Natural techniques. Breathing exercises, changing positions, walking, and massage can all help manage pain without medication. Medication options. There are several options, including IV medications and epidurals, which provide effective pain relief. Talk to your provider about what's available at your hospital. Flexibility. Keep in mind that your needs might change as labor progresses. It's okay to adjust your pain management plan based on how you feel. Discuss these options with your provider before labor so you're aware of what's available and can make an informed choice. 6. Stages of labor. Knowing the stages of labor can help you understand what's happening and what to expect. First stage. This is when your cervix dilates from 0 to 10 centimeters. It's divided into 3 phases. Early labor. Contractions are mild and irregular, gradually becoming more frequent. Active labor. Contractions become stronger and closer together. This is when you'll likely be at the hospital. Transition phase. The most intense part, just before full dilation, can be challenging but is also the shortest phase. Second stage. This is the pushing stage, when you'll deliver your baby. Third stage. After delivery, you'll deliver the placenta. Understanding these stages can help you feel more prepared for what's coming. 7. Preparing for postpartum. Labor is only the beginning of your journey. Here are some key postpartum tips. Support system. Arrange for help at home, whether from family, friends, or a postpartum doula. Recovery tips. Rest, stay hydrated, and focus on nutritious meals to aid recovery. Mental health. Don't hesitate to seek support if you feel overwhelmed or experience signs of postpartum depression. Being prepared for the postpartum period will help you ease into parenthood more comfortably. 8. Communicating with your birth team. Clear communication with your birth team is essential for a smooth labor experience. Share your birth plan. If you have a birth plan, discuss it with your care team, but keep an open mind for any changes. Don't hesitate to ask questions or voice concerns during labor. Your healthcare team is there to support you. Stay flexible. Sometimes, labor doesn't go exactly as planned, and that's okay. The goal is a safe and healthy delivery for both you and your baby. Effective communication helps you feel more in control and supported. Thank you for joining us to learn about what to know before going into labor. Remember, preparation can make a big difference, so take the time to understand the process, pack your essentials, and have a plan for getting to the hospital. Wishing you all the best for a healthy and safe delivery.